Yes.
So I really enjoyed the discussion, and I just want to introduce myself. My name is Ahmed. I'm an ophthalmologist originally from Egypt and now working in the UK. It's now 2 years in the UK. So my situation, I'm Muslim. I would like to present some views from my point of view as an ophthalmologist who worked in Egypt and here. And the other thing is the Islamic point of view and the ethical point of view behind offering such bilateral procedure. So what I got from the discussion till now can be summarized by a word in ethics, which is autonomy, which is a patient-centered decision. And the consent is not just a consent, it has to be an informed consent. I've been involved in so many bilateral cataract surgeries, including our staff nurses. Two of our staff nurses who had cataract surgery in both eyes, they are aware of all the risks that we discussed, bilateral cystoid macular edema that can cause a problem and can affect both eyes at the same time, and they might be crippled by this. They are aware about the possibility of minor refractive errors, and they are staff nurses in ophthalmology, so they can easily make out that this can affect them. But actually, they made the decision to go ahead with bilateral cataract surgery. So this has to be considered. So the informed consent is very important. If we can reach a point that the patient will have all the information and will make his decision, then this would be enough for us to go ahead. About the Islamic point of view, I summarized it in 4 principles from Islam that apply to medical ethics. And those are Islamic legal maxims that we apply to other issues as well. First of all is, in Arabic, is called qasd, which is intention. So what's our intention? This is the first principle. Our intention when we offer bilateral simultaneous cataract surgery is basically to benefit the patient, to relieve the patient's suffering, to try and rehabilitate the patient as soon as possible, try to give the patient a chance to avoid multiple visits to the hospital, multiple visits to the optician to fit glasses. So it's basically to benefit the patient. And also our intention is to benefit the public, and is of course not an immoral method to do bilateral cataract. So in Islam, if your intention is to benefit the patient and the public, then you are doing the right thing. There is a sub-principle of this, which is means do not justify the ends. So one is not allowed to use immoral method to achieve a beneficial medical purpose. And in that particular case, if we agree, we are not doing an immoral intervention or something that can be judged as immoral. The second principle is principle of certainty, which is in medicine can be translated as evidence-based medicine. Do we have the strong evidence to do or not to do immediately sequential bilateral cataract surgery? This is a question that we really need to answer. The third principle is injury. Are we harming the patients when we offer immediately sequential bilateral cataract surgery? So of course, harm is not accepted, same as ethics, do no harm, or primum non nocere. The sub-principle here is that any harm of a therapy should be minimized. So the risk versus benefit where we are in immediately sequential bilateral cataract surgery. The last one is the principle of necessity. If you are doing something that others believe that it's prohibited, then if there is a necessity, like for example, our colleague mentioned that a patient might not be able to make it for a couple of visits to do both eyes, and in that case, we are allowed to offer something that's not like the routine standard of care, just to help those patients who have a specific problem. Yeah, the last thing I wanted to mention is working in Egypt and working here in the UK, the patient group is completely different. So if I go back to Egypt at some point, I can't really offer immediately sequential bilateral cataract surgery to my patients because of so many variables. First of all, the patient understanding to their health issue and health problem. Even if you give the patient the full information and you try to get out of the patient an informed consent, most of the patients in Egypt will say, we leave it to the doctor to decide. And in that case, we will be in bias of the surgeon, whether he believes that bilateral cataract surgery is good or bad. So the informed consent will not be like the proper way. So I can't actually offer it to my patients in Egypt, but here, giving the patient leaflets and giving the patients information, sometimes we explain it to them in videos and diagrams. I feel very comfortable giving the patient the information and getting his consent to have bilateral. So the cultural background of the patients and the place we work at is really to be considered. And that's all really.